Now, my last video went through what we do at our clinic to help 18 to 21-year-old patients treat their hair loss. But in this video, I wanted to talk about what 22 to 30-year-olds can do if they experience hair loss. Now, the reason I start this age bracket at 22 is because that is the age we can feel fully confident that the patient has finished puberty. Let's say, for example, a 25-year-old patient who is a Norwood 3 looking to treat his hair loss. A Norwood 3 at age 25 is relatively aggressive and does mean that he has quite a high sensitivity to DHT. If we put him on my baldness aggressiveness index, he gets a score of 6.44, which, as you can see from this table, puts him in the aggressive category. So say this patient comes into our clinic. The first thing we're going to do is perform trichoscopy, where we take a high-powered microscope and look at the hair follicles very closely in more detail. We're able to diagnose male pattern baldness for sure with this patient at this point, and also get more detail about how severe his loss is. We also take trichoscopy photographs in key areas to monitor progression. After a full history and examination, we would then discuss starting this patient on a 5-alpha reductase blocker like finasteride, because obviously given his high sensitivity to DHT, he is likely to lose more hair and we need to put the brakes on further loss. Something to stimulate the hair follicles would also be useful, something like a once weekly microneedling plus daily topical minoxidil. As you can see, there is evidence that a once weekly microneedling session alongside topical minoxidil can improve results. So the good news with this age bracket is that the hair loss is more fresh, and the hair loss being more fresh and more recent means that the hair follicles aren't as damaged as, say, in a 55-year-old patient who comes to us who's a Norwood 3. And that means that the less damaged hair follicles are more likely to be able to be recovered. So a 25-year-old who is a Norwood 3 is more likely to be able to recover his hairline than, say, a 55-year-old who is a Norwood 3. So what we do is we try to maximize the medication route to see how much regrowth we can truly get. And that's exactly what we did for this patient here. This is a patient who came to us as a Norwood 3 patient, and we maximized the medication route and unfortunately weren't able to get regrowth in the hairline that he was happy with. You can see here he had that classical hairline recession, and we did actually manage to get this patient on dutasteride as he tolerated it well and didn't have any side effects. And the good thing about dutasteride is it slows down hair loss the most by blocking a DHT by over 90%. I wanted to show you this example of this patient because he used what we call the dual approach. It's medications to stabilize further loss and hair transplant surgery to restore what he has lost. And that's exactly what this patient did. As you can see, a beautiful buzz cut appearance 10 days after I performed the procedure on this gentleman. And this is exactly how the hair transplant should look. Natural, the angle of the hair is placed correctly, framing the face beautifully. And I'm super excited to see how this transplant grows in 6 months' time. So there you have it, guys. In this age bracket, we try to stabilize further loss, priority number 1. Priority number 2, we maximize the medication route to maximize the chance of hair regrowth. And step 3, if there is no hair regrowth, we use the dual approach of continuing the medications plus hair transplant surgery to restore what the patient has lost. And this is the approach I took. I continue to take 5-alpha reductase blockers. I got a hair transplant on my hairline to restore what I had lost, and I'm super happy with the results. See you in the next video, guys, where I will discuss the best approach for patients over the age of 30 for hair loss.